Hello everyone, my name's Jo Morgan and I'm the founder and CEO of Engendering Change. We are back for our Pamodzi podcast in the lead up to the Ubuntu Tea Party with Emily from Portsmouth City Council's Wellbeing Service. The Wellbeing Service have very kindly sponsored the Health Award for the Inspirational Women of Portsmouth Awards. And so we're really keen to find out more about why you've chosen to do that and the work that you're doing in the city. So thank you so much for joining us, Emily. Welcome.
Thank you very much for having me, Jo.
Pleasure.
Yes, thank you.
So how long have you been working at Portsmouth City Council?
Coming up for 9 years now.
Oh, quite a while. Okay. And what's your current role?
So I'm one of the managers for the Wellbeing Service.
Yeah.
So the Wellbeing Service, as you've mentioned, sits within Portsmouth City Council and the Public Health Directorate. So at Portsmouth City Council, they've got multiple directorates, so we just happen to fall into the Public Health one. Mm-hmm. So as a service, we support Portsmouth residents to stop smoking, reduce alcohol consumption and lose weight. So living life well is our strapline for the Wellbeing Service, and we do a heck of a lot for the community. I'm really proud to work for the Wellbeing Service and be part of the amazing work that everyone does. Amazing.
And is that sort of for every demographic, or is that just focused on adults, or how does that work?
So our service is sort of an 18 plus,
yeah.
But for our weight management service, we offer that to families. So for children, so the National Childhood Measurement Programme, if a parent is sent a letter home and the results indicate that perhaps their child is at an at-risk weight, and then we would work with the family to support them and to make healthier choices.
And who refers them into you then? Is that the school or the GP? How does it work?
So at times we get referrals in from school nurses. The majority of referrals that we get into our service is self-referrals.
Right.
And we get referrals in from doctors' surgeries, hospital departments, social prescribers. So we do get them from all over the place.
And are you seeing the issues around obesity and for any age group? I imagine, but I don't know, I imagine we're seeing that the picture's getting worse on that front. Is that the case?
Yeah, unfortunately, definitely. So we do work with all sorts of demographics, and we're trying to access those sort of minority communities as well, because we do understand that obesity is a problem, and we do live in this obesogenic environment. And it's that although we naturally as human beings have a choice when it comes to sort of having perhaps an apple over a chocolate bar, actually there are other factors that impact our weight, and it's not just our fault, ultimately, politically, and as I said, sort of the wider factors that contribute to weight as well. So we're doing all that we can as a service to tailor our approach to suit the individual there in front of us, because we don't just go in there with weight management intervention, but we look at the person holistically and sort of emotional well-being, a little bit of stress management. Emotional well-being underpins all of what we do, really.
Yeah, that makes so much sense, doesn't it, to take that holistic approach. And how do people receive it? How effective is it? Are people on board with it? Do people get angry about it? Is there a short-term buy-in, but then harder to help longer term?
So we can provide our service up to a year. So we have an amazing weight management programme, whereby we can support clients on a one-to-one basis, but we also have our weight management groups, and our groups are delivered by really engaging, charismatic and also really passionate wellbeing practitioners. And I think generally when it comes to receiving that information, it isn't often that there's that element of resistance, because effectively for weight management, a person in front of me has likely been dealing with that problem all their lives, and they've tried lots of different ways to lose weight, and at times they feel fed up that, what's different about this time. So we support that person in understanding that it takes multiple attempts to eventually find something that works for you. So I really pride our service on the fact that it is received genuinely really well, and they're met with a lot of acknowledgement and empathy from our wellbeing practitioners. I mean, you've got to be a sort of person to work in the wellbeing service to support the person in front of you.
And is there a waiting list for those services?
For our weight management groups, they could potentially be waiting up to a couple of months.
But
it depends how eager that person is to make changes, because it could be that we offer that one-to-one support there and then.
Wow.
So we can fill that gap before they wait for our weight management groups, because they're very, very highly in demand at the moment.
Yeah.
So we want to strike whilst the iron's hot. So we offer that one-to-one support in the meantime. So we could potentially see someone within maybe sort of a week or so of them referring in.
I bet a lot of people listening weren't aware of that service, so it's so good that you've kind of shared this. If people do want to find out more, where can they?
So our website, so that's wellbeingportsmouth.co.uk. We have been working on our website for quite a few years, and I would say that it is fairly user friendly, so you can refer yourselves. If anybody listening to this is really keen to get to know our service more, is they can fill out the self-referral form at the bottom of the website, or they can email in. So we're wellbeing@portsmouthcc.gov.uk, or they can call our landline and leave a voicemail if no one can answer straight away. Our telephone number is 02392 294 001.
Brilliant, thank you. And in terms of challenges for women beyond the sort of weight side of things, what else are you seeing?
So naturally, I guess, within the workplace and also the clients we support, themes of menopause, so perimenopausal symptoms, sort of post-menopause, just that whole journey, that gets voiced regularly, naturally, as women. So that is sort of one of the many challenges that women have to contend with these days. Also body image and self-esteem, and just mental health. You know, that's something that we really want to share. And I think within our groups, or even if it's one-to-one with the person that we're supporting, we're not, we always want to unpick things. We want to really listen to what that person in front of us is saying. And I know I've talked about groups quite a lot, but we really promote a safe, secure environment. You know, we mentioned about ground rules and that. Please share what you're comfortable with sharing. And it's amazing the community that gets built between those that access our service, particularly with the groups. But yeah, we do all of what we can to really normalise what women have to live with, and just ensure that person is feeling properly supported. Yeah.
Really, I'm so pleased to hear that these services are there and available, and that you've chosen to sponsor the award as well. I know that there are going to be so many inspirational people. I don't know how the judges, the panel, choose between them, because there are so many people doing such incredible things. So it's great to see that the council's there doing that work, reaching out to PAMODSI, who's then reaching out to the community, and bringing this together feels like a really kind of positive step forward. In terms of who inspires you personally, is there anyone that stands out either from your own life or, famous kind of figures?
Okay, that's a really great question, Jo. I have a few that come to mind. I think the first one that I want to mention is my mum. My mum's my best friend, and I really struggled to put it into words, actually, but she has raised 3 children, now adults, who are very self-sufficient. And should I be in a position to have children one day, if I'm lucky enough, if I'm even a fraction of what my mum is, then I know that I'm going to be a fantastic parent. I love all of what she is. I love all of what she's about. And she's the first person I call whenever there's a success, or even if it's not a success in my life, just someone that I can talk to. And I just really want to emulate all of what she is to my future kids, should I be lucky enough to have them.
Oh, that's lovely.
And also my team, actually. So we have got sort of a intergenerational working, in that our service is predominantly female. And we have women in their 60s working in the service. We have a sort of age range, maybe 19 to 60. And that mutual respect is there, and the sharing of wisdom and experience. I mean, the youngest team member, I think, she's 19, and helps to keep everyone current. And the practitioners in their 60s, also current, of course, but it's the wisdom and the experiences that they share, and the fact that we all lead each other. It's so palpable and significant. I really struggle to put it into words, but my team and my mum are the two that come to mind for me.
I love that. That's such a great way for a team to operate. So much power in that shared lived experience, isn't there?
Feel it.
Yeah, love that. Well, thank you so much for joining us. It's been lovely to chat with you. I'm really interested to hear about the work you're doing. It sounds absolutely brilliant, and looking forward to connecting with you again. Thank you.
Thank you for having me.
Pleasure.